pharmacology topic is thiazolidinediones. This drug class is part of the oral antidiabetic agents. Let's first refresh our memory on how blood glucose is normally regulated in the body. This regulation is largely maintained by two hormones that work together, insulin and glucagon. As you can see in this image, insulin is released by the beta cells in the pancreas in response to high blood glucose. Its main job is to take the glucose out of the blood and put it into various cells. You can think of insulin as a key that's needed to unlock the door to these cells so that glucose can enter. Insulin will first help glucose move into muscle tissue to be used for energy, and then any excess glucose will be moved into the liver to be stored as glycogen or into fat cells. Now, our other hormone, glucagon, works to counterbalance insulin, and it has the opposite job. Its main job is to put glucose back into the blood. Glucagon is released by alpha cells in the pancreas in response to low blood glucose levels. It takes that glycogen, which is the stored glucose in the liver, and releases it back into the blood to raise those blood glucose levels. Now, for some clients, this blood glucose regulation does not work correctly, leading to hyperglycemia. This can be due to insulin deficiency, meaning the pancreas is not making enough insulin to properly move glucose out of the blood. This can also be due to insulin resistance. With insulin resistance, the receptors on those target cells are not as responsive to insulin signaling as they normally are. You can see in this image that the insulin is binding with the receptor on the cells as per usual, but the cells are not responding appropriately, so the glucose cannot enter and it remains in the bloodstream. Now, coming back to thiazolidinediones, these are indicated for type 2 diabetes only, not type 1. In type 2 diabetes, clients will primarily have insulin resistance, which causes progressive hyperglycemia. Eventually, this is also accompanied with relative insulin deficiency, as the beta cells will lose function over time. The treatment for all clients with type 2 diabetes should incorporate lifestyle modifications, including a healthy diet with limited carbohydrates and processed foods, as well as moderate intensity aerobic exercise. These lifestyle changes alone will likely not be sufficient, so the addition of antidiabetic medications, both oral and injectable, are another key component of treatment. Some clients with significant hyperglycemia may even require exogenous insulin to get those blood glucose levels under control. Thiazolidinediones primarily work to increase the sensitivity of those insulin receptors in the peripheral tissues. Remember, these receptors don't work well in insulin resistance. This increased receptor sensitivity will lead to increased glucose uptake into the cells and utilization for energy. Because of this, these drugs may be referred to as insulin sensitizers. Now, make note here, they do not increase any insulin production, but rather just help the circulating insulin work better. Of course, this means that they require insulin to be present to work, so these drugs may become less effective with the progression of type 2 diabetes as beta cell function and insulin production declines. Drugs in this class include pioglitazone and rosiglitazone. You can easily identify these drugs as they both end in glitazone. To help you remember how these drugs work, think of glucosone when you see a drug ending in glitazone. This should help you remember that these drugs work to help with blood glucose regulation. Now, what really limits the use of thiazolidinediones are the adverse effects that have been associated with them. First off, these drugs have been shown to cause edema or fluid retention. This is thought to be due to a reduction in sodium excretion, leading to both sodium and water retention. Now, there are multiple consequences of this edema. One, it can cause or exacerbate heart failure in some clients. As you can see in this image, there's already congestion present in both left and right-sided heart failure, so increased fluid retention will only worsen that. In addition to that, this fluid retention also contributes to weight gain in many clients, though this is not the only mechanism behind the weight gain observed with these drugs. This effect is noted to be dose-related, so weight should be monitored with dose titration. Thiazolidinediones may also contribute to development of upper respiratory infections, including sinusitis. An increased risk of fractures has been associated with this drug as well. The receptor that is activated to increase insulin sensitivity is also expressed in bones, which can lead to abnormal bone remodeling. The longer the duration of therapy with a thiazolidinedione, the higher this risk of fracture. Finally, these drugs can stimulate ovulation, which may increase the risk of an unintended pregnancy. Because of the potential for increased ovulation, clients should be taught to utilize a form of contraception if pregnancy is not desired. Given the risk of edema and the potential for developing or worsening heart failure, clients should make sure to monitor for symptoms that may suggest this. If symptoms such as dyspnea or edema are noticed, they should be reported immediately to the healthcare provider. Clients should also monitor for the development of hematuria or blood in the urine, as well as dysuria or painful urination. This is because thiazolidinediones may increase risk of bladder cancer, so abnormal urinary symptoms warrant an evaluation by a healthcare provider. Finally, all clients with diabetes should be encouraged to maintain healthy lifestyle behaviors, including daily exercise and healthy dietary modifications, to help maximize glycemic control and overall health.